It's time for another Out and About with Jamie Groud, and this time we'll be talking about hospice, and we'll be chatting with Dr. Patrick Edwards and Anna Sciarrotta. Dr. Edwards is the hospice doctor. You might know his name because he was a long-time Newton Clinic doctor. Now he's focusing on being a doctor for Wesley Life Park Center and for hospice, and Anna is the hospice nurse for the area. We want to give kudos and props to our sponsors, for without them, we would not be able to do Out and About with Jamie Groud. And one of the first sponsors to sign up was Newton Clinic. And they have exciting news. Dr. Ben Schwab is joining Newton Clinic on April 14th as a family practice provider. He's here to care for patients of all ages with expert, compassionate care, and they're excited to have him on board. Help him have a warm welcome. Call him or text him at 641-2112 to schedule your appointment. And again, he's not starting until April 14th, but he is in the provider spotlight. You can check him out on the Newton Clinic Facebook page. Dr. Ben Schwab joining the Newton Clinic. Also, Tony Pesca, IR Realty, longtime friend. We went to school together. She's a great lady, and if you're looking to buy or sell a home, contact Tony at 641-417-8484, 641-417-8484. Tony Pesca, IR Realty. Also want to thank Lisa Zylstra and the gang at Wesley Life Park Center. Make your loved one's day by enrolling them in Willowbrook, a Wesley Life Adult Day Center. Willowbrook on the Park Center campus provides a welcoming and stimulating environment that allows participants to maintain independence while receiving support and encouragement. Social encouragement, engagement, compassion, and companionship, enriching opportunities, they're all provided to give participants a purposeful and fulfilling day. Willowbrook's person-centered care includes exercise focused on total health and well-being, and programming that includes music therapy, pet therapy, and guest speakers, also outings and much, much more. If you'd like to learn more about Willowbrook, give them a call today at 641-791-4500 to arrange a tour at Willowbrook. Also by Westside Java Coffee Bar, free classified weekly. Jersey Freeze, which opened just a couple of weeks ago. Stop on by and see Lynn Donahue and the gang at Jersey Freeze. And don't forget the Van and Bonbon Jersey Freezer. It's delicious. Halo branded solutions with Lynette Baker and Advantage Credit Union.
If you've been fouled by your financial institution, then blow the whistle. This is Coach Miles from Advantage Credit Union with some one-on-one for a financial victory. At ACU, you're treated like you own the team because you actually do. Advantage Credit Union offers great deposit rates. You actually earn interest instead of paying a monthly fee at you know where.
Make shot, good!
If you live or work in Jasper County or 18 other central Iowa counties, you are eligible to join. Visit us in downtown Newton or online at acuiowa.org. It's a game winner at ACU.
Member NCUA.
It's time for another Out and About with Jamie Groud podcast, and this time around we're going to be talking about hospice. And my interview guests are Dr. Patrick Edwards and Anna Sciarrotta. And Dr. Edwards is retired from Newton Clinic, but is also dealing with hospice and working for Wesley Life Park Center. And Anna is a hospice nurse. And one of the things I guess I want to talk about is that my sister has been in hospice for several months now, and I think, over 6 months at this point. And I don't know which one of you wants to take this question, but let's dispel the myth that hospice is necessarily meaning it's a death sentence. Because as I recall, Jimmy Carter was in hospice for something like 2 years. And it doesn't necessarily mean that that is the case. But I remember, Dr. Edwards, when you suggested that my sister go into hospice, that I was a little bit shy about it. But I said, any way that my sister could have better care, I'm all for. And so why did you suggest that my sister get into that?
Well, that's a great question. And it is kind of a myth, which we struggle with quite a bit, that people consider hospice, which is truly end-of-life care, but what is end of life? And certainly for people that are having acute illness or a stroke or end stage of cancer and are going to survive a few days or a couple of weeks, that's extremely appropriate. But hospice can also be very beneficial to people who have a terminal diagnosis but can live for quite a while yet and can benefit from extra care. And it's a great benefit to them. And we see a lot of people who come to hospice and we say, boy, we should have been on board a couple months ago. And the other problem, of course, is we're not always great predictors. Sometimes people do much better than we think they're going to do, which is still very appropriate for them to be on hospice. As long as their anticipated prognosis is less than 6 months, then they're hospice appropriate.
Well, Anna, let's talk about nursing care too, because it seems like on a weekly basis you check in with me about my sister, and I want you to know how I appreciate that. And also the pastoral care that she gets. I appreciate that also. And many times you called and there's been a little change in how she's doing, but a lot of times it's status quo.
Absolutely. So a big part of the nursing care is that we look at taking care of our patients' needs from a physical standpoint, emotional, as well as spiritual. So we do a lot to provide what's called holistic care. So I'm not only going to be focused on what our vitals showing me today during this visit. I'm going to look at what can I do to help this patient to have peace, to have dignity, and to have the support that they need towards end of life, whatever end of life is, because like we discussed, it can be a week from now, it can be 6 months from now, it can be longer than that. We have, besides myself, that I take care of checking vitals, I do a physical assessment, make sure that all of the medications that we have on board are appropriate. I'm acting as Dr. Edwards' eyes and ears as well. So I'm in touch with him probably a lot, a lot more than we need to, but just to make sure that everybody has all of their needs taken care of. But besides me, I also make sure that my aide is helping to meet some of those physical needs. So she helps people with bathing or with hygiene. She'll help people get dressed and fed, and she does so much, goes way above and beyond to make sure that everybody's just really safe and secure and getting great care.
So I have to ask, because I know the gang here at Park Center and Wesley Life do a good job, how does this differ from what they do here at Park Center?
We add additional cares. Places like Park Center, other nursing facilities, and even in home, people are getting 24/7 cares from caregivers. We come in and we provide extra services.
So how is this paid for, Dr. Edwards?
Well, that's a great thing. And again, we need to spread the word on this because the hospice care is all covered under Medicare. All of the services, my services, the nursing services, there's of course the chaplain as a social worker, there's music therapy if people want. It's all completely covered under as a Medicare benefit, and medications and any equipment that's associated with the hospice diagnosis. So if you want your loved one at home and they need a hospital bed, they get a hospital bed, a commode, oxygen. Now hospice does not pay for your blood pressure medicine. They pay for any drugs that are associated with the hospice diagnosis. But basically, if you're in hospice, anything you receive from them is covered under Medicare. Now, of course, there's younger people that are involved, and that's a little bit different. But I would say most of our patients are Medicare, and there's no cost to the family.
I have to ask this on behalf of the people listening, because I know there's people listening thinking, how do you do this job? Is it not difficult to become emotionally attached to some of the people that you take care of?
It can be very difficult at times, but I have to think about just the good that we are doing for people, and just that we are able to help them to just be able to have happiness, to have joy, and to be able to have their wishes met at the end of life. And that is a huge reward for me.
Well, that is fantastic. I don't know which one of you wants to address this, but I believe the pastor is it Jason?
Jason,
Yeah,
yes.
he's
yes.
great. He calls me every week. Tell us about the pastoral care too.
Yeah, so with Wesley Life Hospice, we have 3 spiritual care counselors or chaplains. And so they divide up our different areas that we provide services. So we are in the Des Moines area, we're down in Pella, we're in Indianola, up in Ames, we're all over the place. And so our spiritual care counselors, they will go and see patients that are in their homes, that are in facilities, and they're all great. And just being in the presence of any one of our spiritual care counselors, you just feel at ease. You feel at ease, you feel like you can open up and talk to them, and our patients love them. They have so many great things to say. They'll say, I really enjoyed the visit that we had this month. With some of our services, like our spiritual care counselor, they don't go as often as a nurse or an aide goes for a visit. Nurses and aide typically go twice a week, and our spiritual care counselors will go once or twice a month, or it just kind of depends on the patient.
And I guess I don't want to be too repetitive here, but I guess I'm curious again on what criteria you use to determine end of life kind of services or to get somebody into hospice care.
That's an extremely appropriate question.
Okay.
And it can be, truthfully, it can be very difficult at times. It's sometimes very easy. Again, if somebody has an acute event and things are going badly, but say you have someone with which you're familiar with, a neurodegenerative disease. Well, how do we decide that this patient is now hospice appropriate? And it can be very difficult. It's helped to have a relationship with the patient. So if you've seen them over time, you can say, boy, things have changed over the past 3 months or past 6 months. Oftentimes it's a little more difficult than that because oftentimes we're just meeting the person for the first time. We look for changes, both physical changes, weight loss, functional changes, depending on their diagnosis. But could they do what they did 2 or 3 months ago? Are they able to do their activities of daily living? Are they able to communicate with their family? Are they able to go to the bathroom? So we look for physical changes, and then we also look for cognitive changes. What's their socialization like? Are they now interacting or are they not interacting? Can they communicate? Can they carry on a conversation? And again, physical changes such as, again, the weight loss, skin changes, et cetera. So it's a combination of all those factors that we look at. And, we do the best we can to get it right. And I think we're pretty good most of the time.
I have to ask you this, because you retired from the Newton Clinic. Why did you decide to stay on at Park Center and, deal with the elderly and with the hospice program, Dr. Edwards?
I'll have to ask my wife that. She'd probably have a different answer than me. That's a great question. And I've learned a lot. Of course, I think I still have the ability to contribute. I think I need to stay active. I'm not very good at not doing anything. I think I have enough experience. I've actually done hospice for many years. I was co-director of the Skiff Hospice with Dr. Ruggles for many years. I worked for Mercy Hospice for a couple of years. And then Wesley was kind enough to ask me to help with them. And I like old people. I get along with them pretty well. I think I have enough experience to do a good job. And I think it's an opportunity to serve others.
That's great.
So,
well, props to both of you on this. If somebody listening thinks that their relative might be a candidate for hospice, how do they contact you folks about this? Is there a way to do that, or will you, don't call us, we'll call you kind of situation?
We have an office based in Urbandale.
Okay.
And so we are Wesley Life at Home.
Mm-hmm.
And reaching out to Wesley Life at Home would be the best route to go. And then we can start the referral process. And then we can have a nurse come out to do an evaluation. And then if the nurse talks with Dr. Edwards or our other medical director in Des Moines and feel that the person's appropriate for hospice, then we can go ahead and admit.
And again, Anna, tell us what geographical areas that this hospice covers.
We cover Newton, Pella, all of Des Moines, Indianola. We are up in the Ames area. We cover Marshall County. I believe we're starting Madison County and Mahaska County as well. We are all over.
Mm-hmm.
So be on the watch, because Wesley Life has been growing and expanding, and we're all over the metro area.
It's a great program, and I want to tell you, I give props to Dr. Edwards, to Anna, and of course Jason, the pastor, because they've taken great care of my sister, and of course the folks here at Park Center have done that too. Dr. Edwards, I want to shift gears.
I want to answer your question a little bit more. The last
okay,
question,
sure.
Because there's more ways. I've been in town for quite a while, so you can call me. You can call the Newton Clinic, and they'll get the message to me, or you can stop by my house. I don't care. So really, I'm pretty accessible. If I was just in town and say I want to decide, I would just call the Newton Clinic, and they will get that message to me, and I will get back to you on that.
641-792-2112.
Correct.
I've got that number memorized.
Yep. So we are accessible. We try to be accessible. And even if you just have a question, please feel free to call me, and we can talk about it.
I wanted to shift gears just a little bit and get off the subject of hospice, because I've done a couple of podcasts with Lisa Zylstra about Alzheimer's and dementia, a fundraiser that you've been trying to do. You folks have had a committee trying to improve at Park Center that department. Have you reached your goal yet, or are you still working on that goal?
We are pretty darn close.
I was thinking that you were real close to reaching that goal.
Yeah, well, this is thank you for bringing that up, by the way.
Yeah.
This is really a neat project. Dementia and Alzheimer's disease. Alzheimer's, of course, a subgroup of types of dementia, is a huge problem, not just in Jasper County, not just in Iowa, but over the entire country, as we hit a markedly aging population. We are not prepared to deal with this. There's not enough resources in the world to deal with this, as we're seeing all over the world, actually. Park Center has a Garden View, which is a dementia unit. It's about 20 years old, maybe a little bit older. And the project is to bring that up to current standards, to remodel it, make it better, use the things we've learned over the last 20 years, and to make it a better place to treat people with dementia.
How so?
Well, it's the best thing for people with dementia is not necessarily drugs.
Okay.
It's to be treated with respect in a home-like area, where it's calm, where they can be comfortable, receive adequate nutrition, receive adequate interaction with other people. And, things have changed in 20 years. We want to make it a little less clinical, a little more home-like, update the fixtures, paint the walls, redo the bathing area, redo the kitchen area. So instead of your meals being prepped someplace else, they'll be making more of the meals there. So people can smell the food, and et cetera. And they're going to redo the outside area. There's a beautiful outside area that's needed some work. Trees get overgrown.
Sure.
Bricks are falling apart, and so that's going to look really nice.
Good.
And it's good to get people outside, a little fresh air and sunshine.
You bet. You bet. Great program. If you want more information on that, get a hold of Lisa Zylstra or Dr. Patrick Edwards about that program or about hospice. And again, you can contact him through the Newton Clinic at 641-792-2112. Our interview guests have been Dr. Patrick Edwards and Anna Sciarrotta on Out and About with Jamie Grout. We're going to do a video shortcast here in just a couple of moments that you can see if you don't have a lot of time to listen to this podcast. But hospice and, of course, Alzheimer's and dementia, both great programs, too, here in Jasper County. Thanks for joining us on Out and About with Jamie Grout. This podcast is also sponsored by my friends at Ryan's Tire and Auto on First Avenue, Newton. At Ryan's Tire and Auto, they offer a wide range of services, including tire sales and service, oil change, brake repair, diagnostic services, general auto repair, and custom accessories. I give a testimonial. They have serviced my vehicles. They've done a great job at competitive prices for my vehicles, and they'll do a great job for you at Ryan's Tire and Auto on First Avenue in Newton. Also by the fine folks at Mercy One Newton with their big gala coming up on Saturday, April 26th. Save the date. It'll be at the DMAC Conference Center with a social hour beginning at 5:30, featuring a cash bar and dinner at 7 p.m., dessert, live, and silent auction getting underway. They'll have a 50-50 drawing and a wine toss, and all proceeds from the event will support the Mercy One Newton Emergency Department. Sponsored by the Mercy One Newton Auxiliary Foundation. Tickets are $60 per person and available at mercydesmoines.ejoinme.org/Newton Gala 2025-tickets. Or if it's easier, call 641-787-3179 for the big Mercy One Newton Gala to raise funds for a renovated emergency department at Mercy One Newton. It's going to be a good time, and a friend of mine, Dale Hansen, who got me started in radio, is going to be donating a Terry Bradshaw autographed football, amongst other things. There's going to be a Ozark getaway that will be auctioned off too at that Mercy One Newton Gala. It's going to be a blast, so make sure you come on out and enjoy it. Until next time, out is out. See ya.